Cochlear implants are one of the neatest things I do. It's one of the few procedures where you're really able to restore somebody's sense. I mean, we have 5 special senses, and hearing is one of them. To be able to return that to somebody is pretty amazing. It's an incredible opportunity. It's an outpatient procedure. It takes about 30 to 45 minutes to perform. The patient goes home the same day. They come back about a month later, and we activate the device. It's indicated for patients that are either born deaf or patients that have acquired hearing loss. So, older people that are slowly losing their hearing, eventually they fall into a category where they would benefit from a cochlear implant. Usually, that's when they hear it worse than a 70 decibel threshold and get less than 50% of the words correct on testing in the booth. The risks are small, calculated. Like I said, it's a very well tolerated procedure, and there's a whole lot of people that are candidates for it that back out of it because they're afraid of it. Now, I don't mind it so much in somebody that's older that says, I don't want to do it, I'm too old, I don't want to go through the procedure. That's okay. Where it really, unfortunately, is troublesome, I think, for me and really for society is in kids. When we get these kids that are born deaf that they're 35 minutes away from normal hearing sensitivity. And the parents, were scared of it. They said, you're not going to cut on my baby, and they don't bring them in. By the time they're 4 or 5 years old, they come into my office, but by then it's too late. They can't have a cochlear implant. Cochlear implants work when they still have, the nerves in the brain. So in the example of a child, when a child's born without hearing, when they're first born, they've got this great big tree full of neurons. Is kind of the way I like to tell people. And there's lots of leaves on this tree, lots of neurons going everywhere in the brain, but when you don't hear anything, it's like you're not watering that tree. And those leaves, the tree starts to die and the leaves fall off slowly. And by about a year, you're missing about half the leaves. By about 2 years, you're missing almost all the leaves. By 3 years, you're starting to get the branches to fall off that tree. By 4 years, most of the branches are off, and you're left with a couple of major trunks or whatever. And then much beyond that, and the cochlear implants really don't work very well. So there's a sort of a public service or a community outreach component to cochlear implants that we need to make the practitioners aware, we need to make the families aware, and we need to sort of build trust in them so that they're not, so that they're less scared about the idea of a cochlear implant. These kids, when you're born deaf, if you get a cochlear implant by the time you're a year old, you're going to go to a regular school, you're going to talk on a regular phone, you're going to listen to music like everybody else. You cannot differentiate these people from from normal hearing individuals. So it's a really powerful technique.